Last month, a medical device startup lost $5 million deal because they didn't understand one simple difference I'm about to show you. Today, I'm exposing the truth about medical coding that nobody talks about. Hi, I'm Lisa Voronkova, and after helping over 150 medical device companies navigate the market, I've seen one mistake cost companies millions in lost revenue. It's about two little acronyms that control everything in the healthcare billing: HCPCS and CPT codes. Let me break this down in the simplest way possible. One is for what doctors do, the other is for what they use. Get this wrong and your brilliant medical device might never see the light of the day. First, let me show you why this matters so much. Here's a quick story. We had a client who spent $2 million developing a revolutionary wound care device. They were ready to launch when they realized they had no idea how hospitals would actually bill for it. Their entire business model collapsed because they didn't understand what I'm about to show you now. Let's make it crystal clear. CPT codes are for actions, what doctors do, procedures they perform, tests they run, and HCPCS codes are for things: medical devices, equipment, supplies, drugs. Let's start with CPT codes. Think of this as the action codes in healthcare. CPT codes have three categories. Category 1, the everyday stuff. It's like doctor visits, surgeries, lab tests. Every code is exactly 5 numbers, like 99213 for a standard office visit. Category 2, the quality tracking. It used to measure performance, not for billing. Optional but valuable. Category 3, the new stuff. Experimental procedures, new technologies, temporary codes while we figure things out. Here's exactly how this works in real life. When a surgeon uses your device in an operation, they're using a CPT code to bill the procedure. Now let's talk about HCPCS codes, what I call the thing codes. HCPCS codes had 2 levels. Level 1, identical to CPT codes used for procedures, 5 numbers. Level 2, that is where it gets interesting. Starts with a letter, then 4 numbers. It's used for equipment and suppliers. That is what you need if you're selling medical devices. Here's where the most companies lose millions. They don't understand which code they need and, more importantly, how to get one. Ask yourself these questions. Is your device used in a procedure? Is it something patients take home? Is it permanent equipment? And your answer determines whether you need a CPT code, HCPCS code, or both. Let me give you the exact step to figure this out for your device. So step 1, product classification. Define exactly how your device is used. Determine if it's part of a procedure or standalone. Identify your target users. Step 2, code research. Look up similar devices, check existing codes, identify reimbursement rates. Step 3, strategy development. Decide if you need new codes. Plan your application process and build your evidence package. Look, I've just given you the exact framework we use to help medical device companies secure proper coding and reimbursement. But this is just scratching the surface of what you need to know about medical device development. That's why I've created something special for you. It's called the Complete Guide to Designing Medical Devices. It's exact blueprint we've used to help over 150 companies bring their devices to market. You can download it right now at ovosolutions.com. And hey, if this video helped you understand medical device coding better, the best way you can thank me is by leaving a comment below. Share your biggest takeaway or what topic you'd like me to cover next. Your comments are helping me to create more content that actually solves your problems. Remember, in medical devices, brilliant technology is not enough. You need to understand how people will pay for it. Get your coding right from the start and you'll save millions in the long run. I'm Lisa Voronkova and I'll see you in the next video.